The cornea is the window to our sight and our first line of defense against injury. Yet, corneal diseases remain a leading cause of blindness worldwide, affecting more than 23 million people. Today, the only available treatment is cornea transplantation, but this solution has major limitations. There's a severe global shortage of donor tissue. Only 1 out of 70 patients who are in need of a transplant will receive one. There's always the risk of immunorejection, and some corneal diseases cannot be treated by cornea transplant at all. So my research asks a simple but powerful question. What if we could eliminate the need for cornea transplant altogether? What if we could use a patient's own stem cells to heal the eye and restore vision? That's exactly what my team is working on. We have developed a safer method to grow patients' own cornea epithelial stem cells in a dish and transplant them back to the patient's eye, restoring a clear cornea surface without the risk of immunorejection. I am especially excited that our ongoing clinical trial is showing very promising results. We have successfully grown and transplanted these cells for every patient in the study so far with 100% success rate. Our goal is to move this into the next clinical phase and make this therapy available to patients in the near future. In parallel, I'm also developing a second therapy aimed at preventing corneal scarring. This approach uses exosomes, tiny particles released by specialized corneal stem cells that carry special signals capable of shifting wound healing from scarring towards true regeneration, allowing the cornea to heal clear rather than opaque. Together, these strategies move us closer to a future where blindness from corneal disease is not treated with replacement, but rather prevented and reversed through regeneration.